don't have to stand here and do this.
I know.
Imagine this. You're on your way to the bathroom when all of a sudden, as you open the door, you come across an unconscious man or woman. Would you know what to do? Would you know how to help this person? One of the best ways to prepare for an emergency is to learn cardiopulmonary resuscitation. Or CPR. CPR is a combination of chest compressions and mouth-to-mouth breathing that can be used on children and adults. Call 911 immediately if you think it's in a medical emergency, or if you or someone else has chest pain, difficulty breathing, or severe bleeding, sudden weakness, or numbness. However, what you as a bystander should actually do in an emergency situation really depends on your knowledge and comfort level. The bottom line is that it's far better to do something than to do nothing at all if you're fearful or your knowledge or abilities are 100% complete. Remember the difference between you doing something and doing nothing can be someone's life. Here's the latest advice from the American Heart Association. If you are untrained, then provide hands-only CPR. This means uninterrupted chest compression for about 2 per second until paramedics arrive. You do not need to try rescue breathing. If you are trained and ready to go, and confident in your ability, then you can opt for one of 2 approaches. Alternate between 30 seconds of chest compressions and 2 rescue breaths, or just do chest compressions. But if you are trained and rusty, but you are not confident in your abilities, then it's fine to just do chest compressions. CPR can keep oxygenated blood flowing to the brain and other vital organs until more definitive medical treatment can restore a normal heart rhythm. When the heart stops, the absence of oxygenated blood can cause irreversible brain damage in only a few minutes. Death will occur within 8 to 10 minutes. Time is critical when you are helping an unconscious person who isn't breathing. Before you again assess the situation with CPR, before performing CPR. Is the person unconscious or conscious? If the person appears to be unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and 2 people are available, one should call 911 or the local emergency number, and one should begin CPR. If you are alone and have immediate access to a defibrillator or a telephone, call 911 before beginning CPR, unless you think the person has become unresponsive because of suffocation, and in this special case, begin CPR 1 minute before calling 911. If an AED is immediately available, deliver 1 shock as advised by the device, then begin CPR. Remember your ABCs. Think airway, breathing, and circulation. To remember the steps explained below. Move quickly through the airway and begin begin chest compressions to restore circulation. Airway. Here's the airway. First, put the person on his or her back on a firm surface. 2, kneel next to the person's neck or shoulders. And 3, open the person's airway using a head tilt chin maneuver. Put your palms on the person's forehead and gently tilt back the head. Then with the other hand, gently lift the chin open to the airway. Check for abnormal breathing, taking no more than 5 or 10 seconds. Look for the chest motion, listen for normal breathing, and if the person isn't breathing normally, and you are trained in CPR, begin mouth-to-mouth breathing. If you believe the person is unconscious from a heart attack, and you haven't been trained in emergency procedures, skip the mouth-to-mouth rescue breathing and proceed directly to chest compressions to restore circulation. Breathing. Breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. With the airway open, use the head tilt chin maneuver. Pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Prepare to give 2 rescue breaths. Give the first rescue breath, lasting 1 second, and watch to see if the chest rises. If the chest does rise, give the second breath. If the chest doesn't rise, repeat the head tilt chin lift maneuver and then give the second breath. Begin chest compressions to restore circulation. Circulation. Restore blood circulation with chest compressions. Place the heel of one hand over the center of the person's chest between the nipples. Place the other hand on top of the first hand. Keep your elbow straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms, and push straight down on the chest 2 inches. Push hard and push fast. Give 2 compressions per second, or about 120 compressions per minute. After 30 compressions, tilt the head back and lift the chin up to open the airway. Prepare to give 2 rescue breaths. Pinch the nose shut and breathe into the mouth for 1 second. If the chest rises, Give the second rescue breath. If the chest doesn't rise, repeat the head tilt chin lift maneuver and then give the second rescue breath. That's one cycle. If someone else is available, ask that person to give 2 breaths after you do 30 compressions. If the person has not begun moving after 5 cycles, or about 2 minutes, and an automatic external defibrillator, an AED, is available, apply it and follow the prompts. The American Heart Association recommends administering 1 shot, then resuming CPR, starting with chest compressions for 2 or more minutes before administering the second shot. If you're not trained to use an AED, an 911 operator may be available to guide you in its use. Trained staff at many public places are also able to provide and use an AED. Continue CPR until there begin signs of movement or emergency medical personnel take over. All in all, learning the importance of CPR could really help save someone's life. Just think about it. It could be your life in the hands of someone else. Would you want them to let you die or keep you alive till medical help arrives?